All right, so today's webinar, we are going to talk about healthy habits for back to school. Whether your kids are going back to school, whether your older children are going back to college, or if you're going back to being in person at the office, having to commute a little bit more than you have had to working at home. So before we get started, give you a little bit of background about Aligned Modern Health. So what is Aligned Modern Health? We are an integrative clinic, both focusing on internal medicine as well as physical medicine. I myself am lead or head of the physical medicine team at our Vernon Hills location. As you can see, we've got 4 different primary services. So we've got our chiropractic side of things, dealing with musculoskeletal injuries, complaints. We've also got clinical massage therapy that can be incorporated into treatment plans. Patients can also opt to do massage therapy on its own instead of chiropractic or rehab as well. And then more on the internal side of things, we have acupuncture, which plain and simple, I tell patients that acupuncture can treat anything and everything under the sun. So as you can see, they work with stress, anxiety, depression, musculoskeletal injuries, men, women's health, as well as a plethora of internal issues. So I personally do refer back and forth with our acupuncturist quite a bit because she does such a great job at co-treating with a wide range of musculoskeletal injuries. And then lastly, we have our functional medicine team along with clinical nutritionists. So they're dealing more with labs, looking at objective lab data, helping you come up with a diagnosis of what's going on internally. Now they treat anything from skin issues, gut issues, hormone issues, anxiety, depression, weight management, diet changes, things of that nature. So giving you a little bit of an overview of our clinic as a whole. Cool thing about our office is we are able to refer in-house. So if you're not responding on my side of things musculoskeletal wise, and I think, hey, there may be something more internal going on, I'm going to easily send you over to our functional medicine provider so she can take a look. She can take a little bit deeper dive. And if there is something going on internally, she's able to clear it up, and then we get you right back to rehab or chiropractic care. And you'll be surprised at how quickly your symptoms change once everything is falling into place and everything, is regulated as it should be. A little bit about myself. So as I had mentioned, I am the head of the physical medicine team at the Vernon Hills location. I am a chiropractor by trade. I enjoy active rehabilitation as well. So been with Aligned Modern Health for almost a year now. Did my undergraduate studies at the University of Kansas. After that, went on to graduate school at University of Cleveland, Kansas City, otherwise known as Cleveland Chiropractic College. You can see my bachelor's degree. I also have my doctorate of chiropractic, and then additional training and certifications below. A little bit of it is active release technique, McKenzie method, MDT, which is a big component of our practice, both at all locations at Aligned Modern Health, SFMA, dynamic neuromuscular stabilization, and then a little bit of functional soft tissue and taping as well for just maintaining symptoms outside of the office. So let's dive into our topic today. So first, we'll just talk about general posture stats and how it affects healthcare as a whole. So as you can see, I'm not going to read all of these bullet points, but just to name a couple, on average, the typical American is sitting about 11 hours a day. Now that can be 11 hours throughout the workday, depending on what their activities look like. But say a person works about an 8-hour workday, 9-hour workday, they're actually going home. And as you can see on the left here, 65% of Americans, or over half of Americans, are coming home from their 9-hour job, 9-to-5 job, and then sitting for an additional 2 hours, whether they're watching TV, eating dinner, reading a book, whatever the case is. We tend to be falling more toward a sedentary lifestyle. And as you probably hear from news outlets, other healthcare providers, this can be detrimental to our health. It's estimated that sedentary lifestyles are responsible for about $24 billion in annual medical spending. So That can be a wide range of issues or complaints going on, but in general, that sedentary lifestyle is a major contributing factor to, common issues that we see in the American population today. It's also estimated that around 300,000 deaths occur annually due to inactivity or sedentary lifestyles, in addition to poor dietary lifestyle habits. So I'm sure many of you have heard of the SAD diet, the standard American diet. It can't be more true today with just everything that's being put into our foods, the soil being depleted a little bit more, so we're not getting essential minerals and vitamins that we used to get maybe 50, 100 years ago. So just a couple interesting stats to look at and have in your back pocket of more reasons to be aware of your posture, be aware of your activity throughout the day. So tailoring off of sitting, we'll talk a little bit about disc pressure. So what is a disc, or what is an intervertebral disc? So these discs are pretty much shock absorbers for the spine. So if you think about your spine, everybody knows you have vertebrae or bones that consist of your spine. Well, in between each vertebrae, we have what we call intervertebral discs. Now, like I said, they're shock absorbers. They help space out the vertebrae. They add a little bit of mobility to our spine so that we can flex, extend, rotate. And again, they act to tie everything together along with all the passive structures as well. But our posture is going to affect how much pressure is occurring on those discs. So as you can see in this graphic, standing actually has the least amount of disc pressure being exerted on it through gravity and through external forces. As we sit down and recline a little bit in an extended position, you increase the disc pressure. If we sit up a little bit taller, disc pressures increase further. Now, as we start to flex forward, as you can see on this last picture, the disc pressure really starts to increase. And I can take it even a little bit further in saying, if we're seated in this flexed position and then we rotate, or we have some type of vibration or oscillation where we're bouncing up and down, good example is a truck driver, that's going to increase the disc pressure even more. So when you think about herniated discs, bulging discs, right, it necessarily doesn't happen with just one time of flexing forward or one time driving in the truck, but think about it as a reoccurring phenomenon happening day in, day out, 11 hours a day. Again, thinking back to that statistic of people sitting 11 hours per day. And just over time, that starts to degenerate the discs. Now, these discs aren't as nutrient rich or have as much blood supply. So when you do injure these discs, it takes a little bit longer to heal versus a muscle tear, muscle strain, things of that nature. So starting from the top down, let's talk a little bit about head and neck posture. So ideally, right, if you think about discs, right, discs are in the low back, they're in the mid back, they're in the neck. We don't want to be flexed forward as much because it's going to increase our disc pressure, but it's also going to increase strain on these lower joints in the cervical spine or the neck. So general rules of thumb, what you want to think about is retract your chin slightly. So you almost think about it as a chin tuck or a double chin. I always tell patients when we're doing rehabilitation or just talking about desk ergonomics, imagine a string is pulling you from the top of your head. So if someone's constantly pulling you from the top of your head, you're naturally going to want to elongate your spine. Just thinking about this position will help decrease this pressure. It will help decompress the spine actively. And then another big important aspect is making sure you're keeping your shoulders nice and relaxed. You want them in a neutral position. Again, if we're working on the computer, we tend to be more in a rounded position in the shoulders, which is going to add strain. And we don't want to feel like we're constantly carrying tension in the upper shoulders. Very common, we see this with patients who deal with a high stress, whether it be job, family, whatever's going on. A lot of times we tend to carry more stress in our upper traps, upper shoulders. A good analogy to think about, again, looking at this graph, is think of your head as a bowling ball. So the farther that you have your head leaning forward, the more pressure or the more poundage is going to be exerted on the spine. Now, commonly as we age, the most common site we see where we start to get arthritis or we start to get degenerative disc disease, say that 10 times fast, the lower cervical spine, the lower neck tends to take the most brunt of the forces that we're exerting on it. So as we get older, as we take x-rays to see what's going on, generally we see that C5, C6, C7 start to generate a little bit earlier than other parts of the cervical spine. So moving on to our commutes, whether we're riding the train, whether we're riding the school bus, whether we're driving our car, a couple tips and tricks to think about when you're on your next commute. So what you want to think about is, just like this first picture, you want to think about pretty much your hips to be as far back in the seat as possible. So you want to have your butt touching the back edge of your seat. You should be in an upright position, so you shouldn't be slouched forward. You shouldn't have excess flexion in the low back. Ideally, you want to have both hands on the steering wheel at that 10-2 position that was beat into us in driving school and when you were learning how to drive, maybe by your parents. You want to distribute the weight evenly between both hips, so you don't want to be favoring, say, your right glutes or your right butt more so than your left. You want to ideally have an even distribution of the load. And then an easy tip and trick is having a McKenzie roll or a lumbar support, whether you roll up a towel, whether you roll up a sweatshirt. Some cars nowadays actually have a feature in their vehicle where you can inflate the back side of the seat to support your low back a little bit more. Now, if you're on a bus or a train, say your kid's riding the bus to school, or say you're riding the train to work downtown, wherever the case may be, same rules apply. Ideally, you want to have your hips far back in the seat. Your feet should be firmly planted on the floor, knees bent at a 90-degree angle, and then again, having that back support when necessary. Now, I will emphasize that, you know, if you're having a 15-minute commute or a 30-minute commute, you know, being in this ideal posture, right, quote unquote, is best to reduce stresses on the joints and on the disc pressures. But we're meant to be active human beings. We're meant to move, right? Our bodies are designed to move. So if you're on a road trip, or your son or daughter is going on a field trip, right, and they're in the car for a little bit more of an extended period of time, I would recommend changing your positions frequently. So even if you have a good posture, right, but you're there for hours and hours, you're still going to get probably some aches and pains. So it's good to change up the frequency of your position. Again, long road trips, car trips, you want to maybe get out and stretch when you guys are taking a bathroom break or when you're getting gas. Again, just breaking up the monotony of sitting in one position for too long. So say we're commuting with a backpack or a briefcase. A couple tips and tricks for this is, especially students, younger kids who are still developing, you want to keep the load relatively light. So whatever the body weight is of the child, we recommend about 10 to 15% of their body weight. That's about the max that you want to have in their backpack. You want to make sure that they have wide straps on their shoulders for comfort. It helps, again, just distribute the force a little bit so it's not pressing down on one specific spot. And say they have a single strap backpack, you know, and they favor their right side all the time, or say you're carrying a briefcase or a computer backpack and you always have it on your right shoulder. Each day, try to change that up. You know, you wear it on your right shoulder on the way to work or way to school, and then wear it on your left side on the way home, or change it day to day. Just make sure you're changing the frequency. And then a couple tips, right? You don't want to always bend at the waist to where you're causing a lot of low back flexion. Okay, think about that flexion causing more disc pressure. Do that time and time and time again. You're going to get more. You're going to get a higher chance of causing something to go wrong, increased pain. So you want to ideally have more of a squat position. Now, if you bend at the waist one time, not detrimental, but again, we're thinking about this as a repetitive habit, right? We want to create good habits early and often. So having a good squat position, just making sure that the biomechanics are sound. So let's talk a little bit about desk ergonomics. So setting up your desk, setting yourself up for success if you are an at-home worker or you are sitting in an office chair for 8 hours a day. Same thing goes for students who are having to sit at their desk for 8 hours a day, 7 hours of the day. Couple of thoughts with this is the percentage of pain reported with a desk worker. So most common pain areas, as you can see, is the low back being number one at 63%, followed by the neck, shoulder, and wrist, right? And it makes sense when we look at that position or when we look at this person sitting at the desk, right? Not ideal, excessive load here, a little bit too much flexion here, maybe carrying some stress in their shoulders. Now, this doesn't equal 100% because more times than not, patients coming in or patients that are reporting pain while sitting have multiple areas of complaint. So they can have a low back and hip complaint. They could have a neck and shoulder complaint. And with that being said, say someone just has shoulder pain, say someone just has wrist pain, say someone just has hip pain. An interesting study done by Richard Rosedale shows that patients who came in with shoulder pain, wrist pain, hip pain, about 40%, if not more, with that isolated extremity pain, who believed it was coming from their wrist, coming from their shoulder, the actual root cause of their symptoms was the spine. So commonly we see patients who come in with wrist pain, elbow pain, shoulder pain. The actual root cause is something going on in the neck. Now, it could be too much load in the neck. It could be a ticked off nerve root that's aggravating them and sending signals into the shoulder. And same thing with the hip. And with the hip in this study, if we take a little bit deeper dive, the hip is almost about 60%, 70% of the time. If you have a hip complaint, we have to rule out the low back first, right? If we don't do that, care is going to take longer. We're going to have missing pieces. You could be getting better temporarily, but then you're going to have constant flare-ups. This pain is going to keep on coming back. So first and foremost, any good conservative care specialist should always rule out the spine before solely focusing on an extremity complaint. So again, a little bit of ideal posture while sitting, right? We want to sit up nice and tall. We want to keep our shoulder blades back and down. We want to be relaxed in the upper shoulders. The seat should be 2 inches behind the knee. The feet should be flat on the ground. Again, 90-degree angles at the knee, at the hip, and also at the elbows. Now, again, we can have 90-degree position at the elbows, but if our shoulders are up by our ears, still not ideal, right? Because then we're constantly having tension and stress on the upper shoulders. So I tell people, first and foremost, make sure those shoulders are relaxed. You have no tension whatsoever in the shoulders, and then bend your elbows to that 90 degrees, and that would be your ideal placement. As you can see, which we'll get into a little bit here in a second, is monitor should be about eye level. Not oftentimes do we recommend looking down at the computer screen for long periods of time. So again, talking ideal monitor placement, which we just hit on. Screen should be about 18 to 24 inches away from your eyes. It should be eye level. Now, I sometimes say eye level or a little bit slightly higher, right? Just so we're more in that extended position in the neck. If you have a single monitor, have it directly in front of you. If you have dual monitors or you have 3 monitors, make sure that they're in close proximity to each other. And then if you're using a laptop, ideally you would want to get a laptop stand. So again, you're bringing it to eye level, and then get an external keyboard so that you don't have to put your wrists in an awkward position. You've got a keyboard that can move around and accommodate to whatever desk that you're using. And then another tip is when you have multiple monitors, try to rotate the entire body. Now, rotating the neck is not a huge deal, right? As long as they're in close proximity to each other, but make sure you're getting a little bit of your mid-back rotation as well. Now, I will say with this, whether you're a student, whether you're working actually in a career or at your job, taking frequent breaks is going to be essential. And again, I tell patients, set a timer on your phone every hour and get up for about 5 minutes, right? Get up for 5 minutes, walk around your office, or have your student, walk around the classroom. Just get up and stretch. Get up and move your body, because again, that's what we're designed to do. Now, if you think about it over the years, right, from sitting in school as an adolescent to then being in college, and then also being in your career and still being in that seated position. If we're not taking frequent breaks, then the years and years that you're putting your body into, your body's smart. So it's going to start to adapt. It's going to start to change. So a lot of times when patients get that pinchy feeling in the front part of their hip, or they feel like they're constantly have tension in their upper shoulders, it's true because your body is starting to adapt. It's starting to physiologically change the tissues, physiologically start to change the structure of what's going on in that muscle, just to accommodate, right? Just to make it a little bit easier, because our body is always trying to use as few calories as possible, right? You think of it as survival mode. We don't want to be constantly burning calories, because then we'll eventually be burnt out, and that's no good for anybody. So our body is smart. It's naturally going to start to make adaptations depending on what position you're in for the most part throughout your years, just so it can conserve calories. And so then say you're in your 50s and you've got really tight quads and really tight hip flexors. Well, it's probably accumulation of years and years of being in that position. So are you going to get relief from 1 or 2 visits? Yeah. But are you going to make permanent changes and feel better long-term? No. Those things take years, right? Those things take months to start to build and break those bad habits. Even with a standing desk, same rules apply, right? Keyboard at a good neutral height. The shoulders aren't raised up. Make sure you're not locking your knees out. Otherwise, you're going to pass out, right? You're going to restrict blood flow to the areas that it needs to go. You want to think about tucking your tailbone underneath you slightly so you can keep a neutral low back, so it's not overextended, it's not overflexed. Again, thinking about that string, bringing you up nice and tall, monitors eye level. Now, if you prefer standing, that's totally fine. Sometimes we recommend floor mats for comfort, right? Because sometimes your feet can get a little bit achy, but a general rule of thumb is best case scenario, you're switching between a seated position and a standing position. So even if you're standing for 8 hours a day, right, something is gonna feel off. Something is not gonna feel the best, right? You're gonna get fatigued. Your muscles are gonna get tired. So making sure we're changing positions frequently, taking breaks, doing things of that nature. Finally, a little bit of some generalized stretching that you can do, whether you're a desk worker, whether your children, can start to get a little bit of movement, because again, harder for children to stay in a seated position for an extended period of time. A couple of general stretches we recommend. Now, this is not a one size fits all. So if you try these at home and they don't feel the best, again, my recommendation is always to consult with a healthcare provider. Consult with your local conservative chiropractor, conservative physical therapist, whatever the case may be, so that you can get stretches, exercises tailored towards you specifically, so that you know exactly what you need to be doing. But general rule of thumb, a couple of stretches that we have are, again, like we talked about, are seated neck retractions. Now, what you want to think about is being in a good position first and foremost. What I tell patients is, let's pretend that your chin is sitting on top of a shelf. And ideally, what you want to think about is just dragging your chin straight back, right? So we don't want to lift up. It should just be a straight back motion. You should feel a slight stretch in the back of your neck at the base of your skull. You should also feel like you're giving yourself a double chin. Now, it's not the prettiest exercise, right? But a lot of patients that come in with neck pain or come in with headaches, cervicogenic headaches, tension headaches, this is going to be a first exercise that we're going to rule in or rule out to see if it's a good fit for you, right? General rule of thumb is holding that retracted position for 2 seconds, relax back to neutral. Now, you don't have to overly flex back to neutral. Just go back to your normal resting state and then repeat the process. There's no ideal sets and reps, right? It's not like you do 3 sets, 10, and you're going to be feeling great. It varies for everybody. So again, I recommend consulting with a provider or just trying it out. Start out with a few, see how you feel. If you're feeling okay, continue to rep it out throughout the day. Good way to use it as your micro breaks throughout the day, every hour, to try to work on these. Next is for low back pain as well as hip pain. So our seated hip openers. So as you can see, what this lady is doing is we want to basically cross one leg over the other, make sure that our bottom leg is planted firmly on the ground, and then we want to gently try to lower our knee towards the ground. Now, a common mistake with this exercise is people tend to try to increase the stretch by flexing in the low back or leaning forward over the leg that's being stretched. I would not recommend this because, again, you're putting your back in a flexed position, may cause more harm than good. And we're trying to stretch the hip, not stretch the low back. So you want to be nice and tall when you're doing this through the spine. And ideally, if you can't get to this about 90-degree or perpendicular angle, start where you can. Just feel a gentle stretch by trying to bring your leg down or your knee down towards the floor. Hold that position for about 30 seconds. Incorporate some deep belly breathing. This is going to help turn on the parasympathetic response of your central nervous system. So it's going to help calm down the central nervous system. It's going to say, hey, tell the brain, hey, it's okay to be in this position. It's going to allow the muscles or whatever is holding you back to start to release and let go. Again, not a general rule of thumb or sets and reps. You can repeat it 5 times per leg, several times a day, but always making sure you're monitoring your symptoms. If it's getting worse or you feel like it's not necessarily feeling the best, go ahead and stop and consult with your provider. Now, most people might be familiar with this one, probably have seen it in yoga quite a bit, right, on all fours, the cat-cow. You can also do it in a seated position, right? So if you don't feel comfortable in the office or your child doesn't feel comfortable doing it on the floor at school, right, because that will kind of bring some attention, you can easily transition this to a seated position. So same rules apply. A couple tips and tricks is as you're extending through the spine right here, you ideally want to take a breath in or you want to inhale. You want to look up at the ceiling so you're still getting some neck extension as well. That's the only other thing I would say about this one. And then as you go to more of that cat position or camel position, you want to flex forward, you want to exhale, you want to let all the breath out and hold that position as well. Repeating several times, right? 1 set of 10, 1 set of 15, seeing how you feel, repeating it a couple times throughout the day. And then lastly, a general stretch that's good is going to be a wall stretch or wall chest stretch for our pectoralis muscles. So as you can see, you can do this seated. If you have a wall nearby, you can do it standing. But ideally, you want to place your shoulder and elbow in this 90-degree position. Now, generally, you want to be facing straight forward, so you don't want to be angled towards the wall. You want to be facing straight forward, and then you want to lean into that wall to where you're starting to feel a little bit of a stretch on that front part of your chest. Now, people who may be a little bit more hypermobile may have to turn their torso away from the wall to get a little bit more of a stretch. But as always, start gently and then progress as needed. So start forward facing. If you're not getting a good enough stretch, then start to rotate your body a little bit to achieve that stretch. And if you've been doing it for a while, you may have to start at that rotated position. So wrapping up some of our final thoughts. One, as we talked about and as I kind of hammered in, we want to move throughout the day, right? We don't want to be sitting that 11 hours per day. We don't want to be even sitting more than 5 hours continuously, right? Trying to take a break every hour or so, whether it's for yourself, whether it's for your kids, right? Especially kids, right? Their central nervous system is starting to develop. They're starting to become curious, right? It's harder for younger individuals to stay seated for long periods of time, and that's completely normal. So we need to make sure that we're getting a variety of movement in throughout the day. And especially if their students are having to be in a seated position from 7 to 3 p.m., right? Make sure, obviously, they get their homework done, but make sure that they're playing outside and make sure that you're not specializing them too much, whether they're playing sports, right? As you're growing, as you're maturing, as your muscles are starting to grow, right? As your central nervous system is starting to mature, we want to make sure that we're introducing different kind of stimulus through exercise, through sports, whatever the case may be, so that their joints start to develop in a healthy fashion and they become a little bit more coordinated. Now, your students or your younger kids are always going to emulate what the parents do. So setting the example at home is first and foremost, right? So if your kids see you exercising at home, chances of them starting to develop that habit is going to be greater, right? They want to be like their parents, right? Their parents are superheroes. So as the parent, setting that example of importance of movement, importance of dietary habits, right? Importance of hydration can go a long way in a child's development. Our second talking point was always keeping our spine neutral, right? Now, this is a general rule of thumb, right? Keeping your spine neutral gives you less shear force, gives you less stresses in the facet joints and the discs, right? So you don't want to be in a neutral position for too long, right? You want to add that variety of movement. But if you had to be in a position for 30 minutes, an hour on your commute, whatever the case may be, keeping a neutral spine with your low back supported is the ideal position. And then third, we want to take mental breaks, right? So although this webinar was tailored more towards the physical aspect, the musculoskeletal aspect, it's just as important as for you to take mental breaks, right? So even if you're exercising as much as anybody, right, you're hydrating, you're doing all the things necessary on the physical side of things and the diet side of things, but you're still constantly stressed or you're still constantly worried or you cannot turn it off, right, when you get home from work, that's going to take a toll. A lot of times patients who come in and again, aren't responding to physical medicine treatments, we want to take a deeper dive because a lot of times mental issues or internal issues can manifest as musculoskeletal complaints. So if we're not addressing the body as a whole, then there's a chance that we're hitting a roadblock and you may be getting re-exacerbations or you may not be getting better as fast. And then lastly, hydrate, right? And so, we don't want to be drinking coffee all day, every day. We don't want to be drinking soda all day, every day. We don't want to be drinking sweet tea all day, every day, right? Those are okay every now and then, but ideally we want to be drinking water. We want to be making sure that we're having enough salt and electrolytes in our water or in our drinks to help the water be absorbed into the cells. So if you're just drinking water, that's a good start, but you want to be adding in a little bit of salt. You want to be adding in a little bit of mineral water. You want to be adding in a little bit of the electrolytes to really get all of the aspects of hydration there. And then general rule of thumb is I tell patients, right, whatever your body weight or a healthy body weight, you want to be drinking your body weight in ounces of water. Now that seems like a tall task, especially if you're just drinking 2 glasses of water a day. Start small. Small wins build momentum. So if you're drinking 2 glasses of water a day, drink 3 glasses of water a day. Do that for a while until it becomes easy, and then increase and increase and increase. Now there's such thing as too much water. So again, making sure you're having adequate hydration, but you're not overdoing it by all means. And that wraps up our presentation for the day. If you guys do have any questions, we can go ahead and put those in the question and answers. If you guys have not been to an Align Modern Health clinic, as I mentioned, we do offer free 15-minute consultations for patients that are interested or not sure on where they need to go. There's our website that you can check out, as well as a phone number for you to call and get scheduled with Central Scheduling System. So with that being said, we'll open it up to questions and answers, and we'll go from there. So we do have a question talking about posture changes for pregnant women. Now, again, this may be a little bit specific to exactly what the complaint may be or what's going on. For pregnant women, much won't change, right? You still want to have a good posture. As you're going along in your pregnancy, things start to change. Your body starts to prepare for the baby. So movement is going to be essential for pregnant patients, right? They tend to be, right, further along in their trimesters, you get a little bit more extension or too much shear force in the low back. So making sure you're adding maybe a little bit more flexion, right? So maybe the lumbar roll may not be best, but again, general rule of thumb, it stays about the same and movement's just as important. And depending on what you have going on, always important to consult with a healthcare provider. And Other question we have, could you repeat the neck exercise that involves the chin? So what you want to think about, right? Already having a good neutral position, shoulders are nice and relaxed. Put your hand right under your chin. So I'll turn to the side. What you want to think about is taking your chin and dragging it straight off your hand. So the hand is the shelf, you're dragging it straight off, and you should create a double chin here. You should feel like a little bit of a stretch in the back or base of the skull. And that should be that exercise for you. Again, working on a set of 10 every so often, every hour, and seeing how you feel from there. So a little bit more of a specific question. Do you add iodized tablet salt to your water, or do you recommend a brand of electrolytes? That would be more of a question for our functional medicine provider. Now, what I do personally, I do Redmond's mineral salt. So it has all of the actual minerals and aspects of the salt in it. I put about, a fourth of a teaspoon in there in the mornings. On electrolytes, I tell patients I like the Nuun's NOO, or it's NUUN, NOON, or NUUN. You should find them on Amazon. Real low in sugar. I think it's less than a gram of sugar, and it's got all the necessary electrolytes. Now, there's a ton of options out there. So again, general rule of thumb, I would recommend consulting with your either healthcare provider or primary care physician or your functional medicine provider, and they can point you in a more general direction. All right. We'll leave it open for about 10 more seconds if anybody else has some questions. All right, guys. Well, again, I appreciate everybody for joining in today. And for those that are going to be watching the recording, I appreciate your guys' time. If you do have any questions, again, always reach out to us. We're willing to talk with you. Free 15-minute consults, right? So you're not signing up for anything. But with that being said, I appreciate your guys' time. Hope you guys have a great rest of your week. And we look forward to either seeing you in person or talking with you guys soon.